Today we are going to discuss about toxicity of leukocytes and platelets. So now we are seeing toxicity of leucons. The leukocytes are nothing but part granulocytes, white blood cells. They play important role in immune systems, which account for 1% of the blood volume and which occur in lymphatic uh, tissues. The leukocytes are neutrophils, basophils, eosinophils, are granulocytes. Under agranulocytes, monocytes and lymphocytes are covered. So unlike the RBC, which reside exclusively within the blood, granulocytes and monocytes generally pass to the blood on their way through extracellular tissue, where they reside in the large number. In the world of clinical and experimental toxicology, the neutrophil is the focus of concern when evaluating granulocyte as a possible target for drug and non-therapeutic chemical effect. Neutrophils, the largest component of the blood leukocyte, are highly specialized in the medicine of inflammation and ingestion and destruction of pathogenic microorganism in the term of when we are considering human. The neutrophil kinetics and response to the disease vary substantially among the animal species. Now, in human, clinically significant neutropenia occurs when the blood neutrophil count is less than 1000 count per microliter of blood. But the serious recurrent infection do not usually occur until count far below 500 cells per microliter cell. So this is a neutrophil kinetics. So neutrophils from circulating blood move through the liver, spleen, bone marrow, and undergo apoptosis, and which generate granulocytes colony stimulating factor. So by this way, neutrophils recycling perform. The morphological assessment of peripheral blood granulocytes can be helpful in characterizing neutropenia. In human and most healthy animal species, mature and a few immature neutrophils can be identified on the blood film. The mature cells have a segmented, whereas immature neutrophils have a bent nucleus. During inflammation, a shift to the left may occur, which refers to the increased number of immature, means non-segmented granulocytes in the peripheral blood, which may include band metamyelocytes and occasionally myelocytes. During such time, neutrophils may also show toxic granules, Rowley bodies, and cytoplasmic vacuoles. These morphological changes may be prominent in a sepsis or as a result of drug or chemical toxication. In order to fully characterize such changes or understanding the pathogenesis of the abnormality, bone marrow must be examined, aspirate, or biopsies. These provide information on the rate of production, bone marrow reserves, and abnormalities in the cell distribution, and occasionally specific clues on etiology of the disease. Now, the toxic effect on granulocytes. The toxicologist is concerned with the effect of xenobiotics on the granulocytes as related to proliferation and kinetics. The extent to which a drug or chemical contaminant can impact the vital function that these cells perform and how neutrophils mediate or accelerate inflammatory disease or other target organ toxicity. Now, this myeloid in hematopoiesis process, the myeloid stem cells give rise myeloblast, which give rise to neutrophil progenitor cells, and which give rise mature neutrophils. which again fights with bacterial infection, viral infection, and tissue injury, and ultimately destroy the foreign particles. Now, this process, uh, after tissue damage, the neutrophils rolling adjacent endothelial cell of the blood vessels by screwing endothelial cells, transmigration due to extravascular tissue, and neutrophils phagocyte the bacterial infection. It releases radiotoxin species, and that phagocytic cells again degranulation, and again macrophage it will launch the process. This is the whole process which involved in the uh, elimination of horse bacteria and foreign particles. Now, the effect on proliferation of kinetics. The effect by cytotoxic drug are generally non-specific. That means they similarly affect cells of the dermis, gastrointestinal tract, and other rapidly dividing tissues. The agent that affect both neutrophils and pose a greater risk of toxic sequences such as infection. The cytotoxic drug vary in terms of their mechanism and most act which inhibit the DNA synthesis of the cell. Linden, an insecticide used to treat seeds and soil, has been associated with the leukopenia. It is cytotoxic for human colony-forming unit, granulocytes and monocytes. Means these pesticides directly inhibit effect hematopoiesis process. An example of chemical that affect mature cells is methyl acetate monomer, which have been used in orthopedic surgical procedure and is cytotoxic to both neutrophils and monocytes at clinically relevant concentration. And another idiosyncratic toxic neutropenia. In ideo, the chemical that unexpectedly damage neutrophils and granulocytes precursor, particularly to the extent of inducing agranulocytosis, which is characterized by the profound depletion in the blood neutrophils to less than 500 numbers per microliter of blood. The preclinically toxicology is rarely predictable of this effect, which are generally detected and characterized following exposure of a large population of the drug. The severity of the neutropenia often causes severe sepsis, a localized infection such as sore throat, pneumonia, and various cutaneous infection. A toxic neutropenia has historically been classified according to the mechanism as immune mediated or non-immune mediated. Now, the leukemia genesis is a toxic response. The leukemia is the sixth leading causing of cancer death among the male and females. Leukemia arises when hematopoietic stem cells or progenitor cells in the bone marrow undergo uncontrolled proliferation and cannot differentiate normally into mature blood cell. Leukemias are broadly characterized as myeloid or lymphoid, depending on the lineage of their origin. Based on the stage of differentiation and rate of clonal expansion, they are also characterized as acute, means rapid onset of immature blood cell, or chronic, more gradually onset over the month or year, more mature cells. So these are the four common leukemia: acute myeloid leukemia, chronic myeloid leukemia, acute lymphatic leukemia, chronic lymphatic leukemia. These myeloid and lymphatic, these again are the involved in hematopoiesis process. So the xenobiotics and the agrochemicals, whatever the chemicals are, directly impact on hematopoietic system, which again lead to leukemia. So leukemogenesis is a multi-sepsis process involve the acquisition of various combination of chromosomal aberration, genetic and epigenetic aberration that transfer a normal hematopoietic stem cell into leukemia stem cell. The resulting altered gene expression pattern disturb critical hematopoietic process such as signal transduction, alternative splicing, and epigenetics, and give rise to cellular phenotypes such as increased proliferation or survival and blockage of differentiation and immortalization. Thus, the bone marrow become a replete with leukemic blast and leukemia stem cells then again replace them. These are the process. The hematopoietic stem cells give rise to different red blood cells, white blood cell, and platelets. But when the xenobiotics impact hematopoietic process by the chromosomal aberration, genetic mutation, epigenetic alteration, these chromosomal effect at genetic level, which directly express gene proteins and ultimately induce survival of different cell, inhibit proliferation, again blockade pathway of differentiation, and again immortalization. Industrial chemicals, various form of radiation, immunosuppressive drug, and infectious agent. The non-genetic causes of acute myeloid leukemia and MDS are ionizing radiation, cytotoxic chemotherapy drug, tobacco smoking, and occupational exposure to benzene or high level of formaldehyde. The alkylating agent such as nitrogen boosters and antimetabolites induce bone marrow damage primarily characterized by pancytopenia, similar to the effect of ionizing radiation. How this effect? The monofunctional means react with DNA at only one side. The alkylating agent such as nitrosols, decarbamide, temozolomide transfer an alkyline group to DNA basis to form lesion that result in the formation of mutations, secondary, secondary DNA double strand break, and resulting toxicity. Some alkaline agent work bifunctionally, means it create cross-link between two DNA standard strands. Alkylators such as cyclophosphamide, methamphetamine, and chlorambuline induce the formation of cross-linking within and between DNA lesion in addition to alkylated base lesion. The resulting double-strand DNA breaks can lead to chromosomal translocation, insertion, inversion, and loss of heterozygosity. The leukemogenesis associated with the radiation involve myelotoxicity, immune suppression, chromosomal aberration, and genetic mutation. Benzene and the formaldehyde are among the few occupational and environmental exposure that have been classified as non-human leukemogenic. These are the schematic representation of how benzene leads to leukemia. Benzene indirectly metabolized in liver, and metabolic activation in liver gives rise to reoxygen species, leptophilic species, aldehyde, and quinone. That active ingredient which affect at molecular level. Again, DNA damage, chromosome aberration, gene mutation, topoisomers to inhibition of DNA repair. All these molecular effect again leads to phenotypic effect. Again, survival of cell, proliferation of cell, and reduction immune suppression. By this way, again bone marrow niche hematopoietic stem cell convert into leukemia stem cells. Now, the toxicology of platelets and hemostasis. The hemostasis is a multi-component system responsible for the preventing the loss of blood from site of vascular injury and maintaining circulating blood in a fluid state. Loss of blood is prevented by formation of stable hemostatic plug mediated by the equivalent arm of hemostasis. The major constituents of the hemostatic system include circulating platelets, variety of plasma protein, and vascular endothelial cell. This is the process of hemostasis. When vessels injury happen, the vessels become constrict, platelets aggregate at the site of inflammation, injury, and it activated plates from cross-link with each other and from private fluid. So by this way, platelet and plasma proteins or other cofactors mediated the hemostasis. The toxic effect on platelet. Toxic effect on platelets ultimately imbalance the effect on hemostasis process. The platelets are essential for the formation of stable hemostatic plug in response to vascular injury. It is essential adhere to damaged wall. It says platelets initially adhere to the damaged wall, initiate biochemical response pathway that leads to shape changes, platelet contraction, platelet secretion of granule contents, activation of glycoproteins receptors, and externalize of phospholipid serine pathway. Again, the activation of the glycoproteins receptor permit fibrinogens and other multivalent adhesion molecule to form cross-link between nearby platelets, resulting in a platelet aggregation. The xenobiotic may interfere with the platelet response by causing thrombocytopenia or interfering with platelet function. Some agents are capable of affecting both platelet number as well as platelet function. The thrombocytopenia, like anemia, thrombocytopenia may be due to decreased production or increased destruction of platelets. The thrombocytopenia is a common side effect of intensive chemotherapy due to the predictable effect of antiproliferative agents on hematopoietic precursors, including those of the megakaryocytic lineage of hematopoietic system. The exposure to xenobiotics may cause increased immune-mediated platelet destruction through several mechanisms. The xenobiotics acting as a heptane after binding the platelet surface, or by xenobiotics causing a neoepitopes to be formed on the platelet membrane glycoprotein. These actions were thought to initiate antibody response, with the responding antibody binding resulting in removal of platelet from the circulating by the mononuclear phagocytic system. More than 100 drugs have been associated with causing immune thrombocytopenia. The example of oxaliplatin can induce thrombocytopenia by both immune as well as non-immune mechanism. Thrombocytopenia is a significant problem for the cancer patient being treated with this third generation platinum drug. The main cause of thrombocytopenia related to oxaliplatin used in myelosuppression, which represent asymptomatic thrombocytopenia. The immune-mediated thrombocytopenia rarely occur during oxaliplatin infusion, but resulting in the severe life-threatening grade 3 to 4 thrombocytopenia that cause bleeding, hypersensitivity reaction, or hemolysis. The toxic effect on blood and on platelet function. The platelet function is dependent on the coordinated interaction of a number of biochemical process pathways. A variety of drug and food have been found to inhibit platelet function either in vivo or in vitro. The major drug groups that affect platelet function include non-steroidal anti-inflammatory drug, beta-lactam containing antibiotics, cardiovascular drug, particularly B blockers, right, anesthetic, antihistamine, and some chemotherapeutic drugs. The xenobiotics may interfere with platelet function through a variety of mechanisms. Some drugs inhibit phospholipase A2 cyclooxygenase pathway and synthesis of chromoxin A2. The platelet response is dependent on a rapid increase in cytoplasmic calcium. So, any chemical that interfere with translocation of calcium may inhibit platelet function. The chemicals that block calcium channel and occasionally drug-induced antibodies will bind to a circulating platelet receptor and inhibit its function. The toxic effect on fibrin clot formation. In coagulation, fibrin clot formation is a result of sequential activation of a series of serine protease that ultimate formation of thrombin. Thrombin is a multifunctional enzyme that converts fibrinogen to fibrin, activates factor 5, 8, 11, 13 protein C, and ultimately platelet, and interact with the variety of cell, activating cellular signaling pathway. The most common toxic effect of xenobiotics on fibrin clot formation are related to a decreased level of one or more critical protein necessary for the process. The decrease in clotting factor activity may be due to decreased synthesis of protein or increased clearance from the circulation. The decreased synthesis is the most often a reflection of hepatocellular damage or interference with the vitamin K metabolism, whereas increased clearance is usually associated with the development of an antibody to a specific coagulation factor. The decreased synthesis of coagulation protein. The majority of the proteins involved in the coagulation cascade are synthesized in the liver. Therefore, any chemical that impair liver function may cause a decrease in production of coagulation factor. The factor 2, 7, 9, and 10 are dependent on vitamin K for their complete synthesis. Anything that interfere with the vitamin K metabolism may lead to deficiency of this factor and a bleeding, and ultimately which leads to bleeding tendency. So the increased clearance of coagulation factor. Again, idiosyncratic reaction to xenobiotics include formation of antibody that react with coagulation proteins. This antibody again bind to the coagulation factors, forming an immune complex, and that is rapidly clearing from the circulation and resulting deficiency of coagulation factors. Again, so by this way, leukemia, leukopenia, and platelet decrease may impact overall function of the hematopoietic system. So, the hematotoxicity test, which involve to evaluate risks that exposure of new drug, chemical product, and other agent possessed to human in terms of significant toxic effect on hematopoiesis and The functional integrity of blood cells and hemostatic mechanism can be logistically and intellectually challenging. The conventional hematotoxicity test in animal which access peripheral blood parameters such as complete blood count, histopathology of bone marrow, and other hematopoietic tissue. Ideally, the study in aggregate should provide information on the effect of single or multiple dose exposure on erythrocyte parameters, leukocyte parameters, and thrombocyte count. Screening coagulation tests such as PT, APTT, peripheral blood cell morphology, and bone marrow cytologic and histologic feature. The cytological or flow cytometric evolution of bone marrow is useful to characterize effect on different hematopoietic lineage or progenitor cells. The important consideration for animal toxicity study include selection of appropriate animal model. Rat and mice are commonly used species and both have been well characterized hematologically. However, their small size small size for serial sampling of blood on bone marrow, large species such as dog and monkey enable serial sampling and are hematologically more similar to human as regard hematopoiesis and blood cell kinetic, which in the monkey extended to immunohematological features. Interspecies differentiation limit the relevance of animal study to human toxicity. The conventional peripheral blood cell parameters in animals have limited predictive value for human hematotoxicity. Animal studies have been less predictive for human recombinant protein, monoclonal antibody, and target that are specific to human tissue and disorder or idiosyncratic disease in human, as such as aplastic anemia, actinocytosis. Mice are not relevant for the testing toxicity of infectious agent with exclusively human or primate horse. In order to improve the relevance of the mouse model for human hematotoxicity, humanized bone marrow xenograft mouse model was also developed. Now, the in vitro bone marrow also is the more relevant for the hematotoxicity assessment. In vitro methods for assessing potential hematotoxicity are faster and less expensive than in vivo study, while
Hello, sir.
providing
If you need the 5 minute break, so we can may stop here.
I think 3 or 5 salad only.
Okay, okay. So not an issue. We'll continue. Okay.
Okay. The suppressive effect on hematopoietic stem cells can be accessed using short-term colonogenic assay, which have been developed for several laboratory animal species. This assay enables the examination of tightly controlled exposure concentration and duration effect on the myeloid, erythroid, and megakaryotic lineage. So these are the 5 types of colonogenic assay: burst forming unit erythroids, colony forming unit erythroids, colony forming unit granulocyte, monocyte, colony forming unit megakaryocytes, colony forming unit granulocytes, erythroids, megakaryocyte, and monocyte. These all are basically concept from the hematopoietic stem cells. So these has the effect hematopoietic stem cells give to rise colony forming unit. This is the example of colony forming unit. So discovery of Genifetin 123 triazole derivative agents get lung cancer via induce apoptosis and inhibit the pulmonary formation. So, in negative control, there is a lot of colony as there is no chemicals which inhibit proliferation and differentiation of the cells. So, where again, as a increased concentration of trace atom, there is no colony formation at high dose level. So, this colony forming unit assay is widely used for assessing bone marrow toxicity. So the in vitro collagenic assay have a number of advantages. Most important is the ability to test human hematopoietic cells directly in a preclinical studies. In vitro assay can be used to test combination of chemical as well as their metabolites and effect of serum and other cell components such as lymphocyte. But one of the limitation of this assay are low throughput capacity, time consuming and tedious because colony forming unit assay typically requires incubation times of 1 to 3 days, and again manually counting can be laborious and time consuming. And third, potential for miscounting. Clumps of bacteria can be misidentified as a single colony and potentially lead into inaccurate count. Some new techniques are use liquid culture in the automated non-polynogenic fluorometric microcultures toxicity assay. Human CD34 cells are incubated in 84 well microplate with drug in liquid culture, supplemented with the granulocyte monocyte stimulating cytokines, after which cell survival is monitored. Extensive validation with the non-myelolytic drug found similar 50% of inhibitory concentration after 7 days of culture as a standard proposed FMCA GSA. The other assay measure intracellular ATP as a measure of proliferation. For example, hello means hemotoxicity assay via luminescence output is a ATP based bioluminescence assay that is conducted in antithesis well culture plate and is completed in half the time of manually colorogenic assay. The Hello box can be used for following tissue, bone marrow, peripheral blood, umbilical blood, spleen, fetal liver, embryonic tissue. And these tests are say also available for human, non-human primates, dog, rat, and mouse. So the blood toxicity is ultimately impact hematopoietic system, and to screening the hematopoietic system, we have to evaluate bone marrow toxicity by the different available of assay. So this is all about toxic response of the blood. Thanks.